We have been using some tools to establish virtual contact with the physicians, even prior to the pandemic. But obviously, once we started with the pandemic, it accelerated a lot. But I think that the companies will notice that the content needs to change. The physicians will demand uh, the content will need to be improved in order to justify the timing the physician is dedicating for that specific visit, contact. So it's important to change the way that we engage with the physicians. And I think that we will use different tools, not only the face-to-face visits, but also improving a lot through digital tools and all and the physicians we will ask for on-demanding alternatives to interact with the pharmaceutical companies.
What we can see is that, at least in Southern Europe, digital, I mean, it has been an increase of the digital, but the overall impact is not so great. I would say we have resumed calls and visits in Italy in particular. And what you see is that with some exceptions, things are going a little bit back to normal. The only thing is that there are hardly no patients on the clinics. Okay, so this obviously is slowing down all the activity. So the frequency of calls that we're getting, we're at 70, 80% what we used to have before. So there's no significant impact. I have doubts on the digital transformation because the engagement of the physicians will be difficult, and all of us are doing multitasking, and at the same time that you're taking care of a presentation, you're checking your emails, so it's difficult to get the engagement. So I'm still on a skeptic position of wait and see to see what happens. Of course, all of us will try multi-channel to see what happens, but I don't think, at least at the moment, that will change significantly the mix. But in 6 months down the road, we will all find out.
I think the future is uncertain. What is clear, though, is that as we've had to evolve over the last 4 or 5 months, and as we continue to evolve our business execution strategies, there are opportunities, and we'll take, I think, what works well, and in some cases maybe a virtual interaction with healthcare professionals at times, and with content that's more tailored to them. I think companies have an opportunity to try and make that work for them, and perhaps to gain an advantage there. But for sure, there'll be elements of what we've taken and what we've undertaken over the last few months that won't be part of the new normal, if we use that phrase.